There are so many ways to treat plantar fasciitis. I always want to start with the basics because I feel that it's very, very important we treat why you have plantar fasciitis. Because I can give you an injection or medication and it will work, but if we don't address the reason why you're getting it, it's just going to continue to happen. So the two reasons why usually patients get plantar fasciitis is foot structure and tightness in your posterior muscle group. So we got to really address that. Number one, stretching. Stretching, and I usually go over some stretching exercises that I want you to do in the morning and in the afternoon as well. Very important you do these. Even if you do get an injection, the stretching is really important because that plantar fascia is very tight and we really want to get that fascia loosened up a little bit. Another thing is support. So when that plantar fascia is pulling on that bone, we want to lift that plantar fascia like this because we don't want that pulling on the bone anymore. And so what does that mean? Good shoes and also inserts. Good shoes is very important, especially when you're very active, if you're exercising, if you're traveling, if you're going to school. That support is important because it's going to eliminate that stress that plantar fascia is doing on the bone. Now, that's usually the first line of treatment for plantar fasciitis. We have to do that, it's a must. Now we can add other things that really are going to boost up that anti-inflammatory cycle and get you pain-free. So there's different ways of doing that. There's oral medication, anti-inflammatories. I mean, you can even start over the counter first, but there's also prescription anti-inflammatories, steroid injections to the heel. Also, there is even newer technology where a laser treatment is also an option. We have here in the office the MLS system, which is a multi-wavelength laser that helps with inflammation around the plantar fascia. It's a very non-invasive way, it's not painful, and it's very easy to do. So again, the goal with all of these other forms of treatment is just to really reduce the inflammation around that plantar fascia. That's what we're doing with any of these. And it's just a preference if you want to do an injection or laser. There's so many different ways, but you really have to always remember, go back to the basics, the support, the stretching, because that's something that you have to do basically lifelong to prevent flare-ups in the future. We see plantar fasciitis every day. Very, very common condition in the foot. So if you have any questions, feel free to call us at our office and we can help you out.